Outside of Joe's forecast today, eventually we're going to see a lot more sun, a lot of warm forecasts on the way. Summer is just around the corner, but you really have to protect yourself when you head outside.
Ladies, I know we want that golden tan, but got to be careful. Fox 28's Mario Gonzalez, he joins us live from Derma Center MD in Elkhart. Now, Mario, dermatologists aim to get this message out all this month for skin cancer awareness.
And to kick off this big push today is known as Melanoma Monday, and we are joined today by dermatologist Dr. Roger Moore. Now, Dr. Moore, just thank you for joining us this morning. Now, first off, tell us a little bit just how serious is skin cancer in the U.S.?
Skin cancer is at epidemic proportions, they indicate. Nowadays, they claim 1 in 3 to 1 in 5 Americans will have some form of skin cancer at some point in their life. Melanoma is the more serious form of skin cancer, and it occurs in about 1 in 49 Caucasians.
And we do have a couple of images. These are just some pictures, maybe some symptoms of melanoma.
Correct. We've taken some photos, just samples of actually patients that we've had here in our office who've had melanoma. So it's actually real live patient pictures that we can kind of look at and get a feel for what melanoma might look like.
So if you want to just show us a few of these pictures, kind of tell us what we're looking at.
The first image has a dark mole with multiple colors to it. Anytime you would get a mole that's unusual and has many dark colors or changes, you'd want to be concerned about it. We also talk about the A, B, C, D, and E's of melanoma. And this would indicate, I'll move to our next image, that the A would represent asymmetry. So if you have a mole that looks a little bit asymmetric, cannot be folded over in half, you'd want to have a little bit of concern for it. The B is referring to the border irregularity. And when you have border irregularity, that means the outer edges are going to be scalloped or changed in some manner, and they don't really look like they're a sharp, smooth surface. C would be color variegation, and that means that a mole would have multiple colors to it, be it dark, whether it's brown, black, white, or pink. Those are all concerning signs, especially if it's something that's changed. And D represents diameter. If you have a mole that is over 5 to 6 millimeters in diameter, it's one that should be evaluated and monitored. And then E is the last one added on, and that means evolving. So if you have any mole that's new or changing, you should have it evaluated and make sure that it's an alright type of mole.
And as Dr. Moore has mentioned, if you have any of these symptoms or maybe you see a mole or lesion and you're just not sure what it is, again, it's not going to hurt to get it checked in. As he's mentioned, melanoma is a serious disease here in the U.S. Steve Farron, back to you.